Good afternoon, Ma'am Lynn. Again, my name is Christine Mitalang, and today I'm going to demonstrate the proper way of getting a body temperature. So, of course, the first thing that we'll have to do is to understand the purpose as to why we have to get the body temperature. And, of course, number one is to make sure that we establish a baseline data. This will also basically help us to check if the core temperature is within the normal range. This will also help us to determine if there are any changes in the core temperature after special treatment or a therapy. And this will also help us to monitor if we have, clients or our client is at risk for imbalance in terms of the body temperature. Now, for the assessment, there are, four things that we have to assess. Number one is clinical signs of fever or hyperthermia, clinical signs of hypothermia. We also have to check for the best site and method, which is of course most appropriate for the measurement of the client. And at the same time, we also have to make sure that we check for the factors that may alter the core temperature of our patient. Now, for the equipment or for the planning, for the equipment, we will be needing a thermometer. So right now, I have two thermometers here, one digital and one digital mercurial. So both I already sanitized prior to the procedure. You'll also be needing pair of gloves, a lubricant for the rectal later on, and at the same time wipes, tissue. You'll also be needing cotton balls, alcohol, and for the temporal and for the tympanic, let's just pretend that this pen light is a thermometer that we use for the tympanic and also for the temporal. So those are the equipment that we need. Now, of course, the first thing that we'll have to do is to check if our equipment are working. So for the digital thermometer, yes, it is working. I've already checked this prior to the procedure. And at the same time, the mercurial thermometer is also working. Now, prior to procedure, we have to introduce ourselves, and at the same time, we verify the patient's information, and of course, explain the procedure as to why the procedure has to be done. So, hi sir, my name is Christine. Ate Christine, I'll be your student nurse for today. Can I have your name, please?
My name is Jaden Krisnetan.
Hi Jaden, and can I have your date of birth, please?
My birthday is on December 11, 2010.
Thank you so much for that. So today, we will be performing, or I will be getting your body temperature. Okay, so we will be using this as a baseline data. And this will basically help us to check if further treatment is to be needed for you. Okay, thank you so much. Now, the next thing we'll have to do is to perform hand hygiene. So I'll be performing now a hand hygiene. Okay, now it is important for us to wear gloves if we are doing or if we are getting rectal thermometer, rectal temperature. So later on, I'll be using gloves once we are in the process of getting a rectal temperature. Okay, so the next thing that we'll have to do is, of course, after we've done hand hygiene, it is now time for us to provide privacy as usual. So we close the door if you are in a room. We also have to make sure that we move the curtains, okay, to make sure that we are providing the privacy for the client. And then after that, we make sure that the patient is positioned appropriately. So if you're getting the axilla, the oral, temporal, or tympanic, we can just have the client sit, okay, just have the client sit, or in a supine position. But for the rectal temperature getting later on, the patient should be in a Sims position. Okay, so now after we're done with that, we will now place the thermometer on the right place. Okay, so there will be 5 sites that I will be explaining. So let's do it one by one. Okay. So for the oral temperature, so we have to make sure that for using a mercurial, it should be less than at least 35 degrees. Okay, so all we have to do is, of course, put the tip, okay, of the thermometer to either side of the frenulum of the mouth. Okay, hi sir. Huh? Ipit po. Ipit. Ay, naman. Hinintang lang. Ipitin mo lang, sir. Close the mouth. Close your mouth. Now, aside from, of course, oral, axilla, and of course, rectal, we can also get body temperature using the tympanic or the ears, okay? So we have a special thermometer for that. But for now, since I don't have one, let's just pretend that this pen light is a tympanic thermometer, okay? So all you have to do is just to pull the pinna, okay? Pull the pinna slightly upward and backward, okay? Slightly upward and backward. And then after that, we point the probe slightly anteriorly towards the eardrum, okay? And then after that, we insert the probe slowly using a rotation motion until it's snug. And then after that, we just have to press it, wait for a while, and then we'll have the thermometer reading. That's it for the tympanic thermometer. We also have the temporal temperature taking, okay, which is of course on the forehead. So all you have to do in getting that is to, of course, make sure that you brush the hair to the side, especially if it's hindering the part, okay. If it's covering, slowly slide the probe to the midline across the forehead to the hairline. And then all you have to do is just to lift the probe to the forehead and then release the button. And then all you have to do is just to wait for the thermometer to read the temperature. So that's the proper way of getting a temporal temperature. Now for getting the rectal temperature, of course, the first thing that we'll have to do is to make sure that we put on our gloves, or let's say position first the patient into a Sims position, which is now being positioned. And then after that, we make sure that we provide privacy, okay? Especially that we're doing the temperature taking on the rectal. And then after that, we put on our gloves. So, and then we get our thermometer. So, do not forget to put on lubricant. So after we put on the lubricant, we advise the patient to deep breathe, okay, while we are doing the procedure. Ma'am, hinga lang po tayo, may insert lang po ako. So we just have to wait for a few minutes, okay, until we've get, or until that we have the right temperature from the rectal. Now for the axilla, the first thing of course that we will have to do is to pat the axilla, okay, pat it dry. Excuse me, sir. Make sure that it's dry. And then after that, we put the tip of the thermometer to the center. Okay, so all you have to do is just, wait for the appropriate time, the amount of time before we remove it. Okay, so normally it takes about 3 to 5 minutes, okay, before we get the right temperature of course of the body. Okay, but since we're using a digital thermometer, we just have to wait for it to sound, or to produce a beeping sound. Okay. Okay, so while we are waiting for it to read the temperature, okay, so once the temperature has been taken, all we have to do is just to remove it and make sure that we wipe it with, a wipes or a tissue, and then we read, okay, and we record the temperature. Now, if the temperature is too high or too low, or it's, let's say, it's really not consistent, then we have to try to use a different thermometer that is, functioning, okay? Because there's a tendency that the thermometer that you're using is not functioning well. And then after that, after we're done recording it, then that's the time that we wash, okay, or sanitize the thermometer and put it back to its storage. Okay, now after we're done doing that, we document. Okay, we document our findings. We document the thermometer on the patient's record. Normally for rectal thermometer, we use letter R, and for axilla, we use letter AX or X. Okay. So let's see. Still not sounding. Okay, now for the evaluation part, okay, for evaluation, basically same thing goes for it. We make sure that we compare the measurement to the baseline data. We analyze influencing factor, and of course the vital signs. You also conduct, appropriate follow-ups with the primary healthcare provider or the physician. If the temperature is outside the normal range, this is for us to make sure that we provide the right interventions, especially if, say for example, after all the medications, all the interventions that you've done, the body temperature is not declining. Okay? So we just have to wait a little bit more. So normally, by the way, for the normal range, okay, of the temperature normal is from 36.2 to 37.7. Taking quite some time. There you go. So finally, it already beeped. Okay, let's check. Excuse me, sir. So it's 36.5. So meaning the patient body temperature is within the normal range. So as what we've discussed a while ago, make sure that we record our findings. Okay. Now for this one, for the thermometer, we make sure that we sanitize it. Okay, before we even put it to its storage. Okay. So we can get, cotton balls. Okay. Normally I just use a cotton ball, alcohol, and then we do it warm up. There we go. And then we can set it aside. Okay, so that's the proper way of how to get the body temperature. Thank you so much for watching, and hope you're having a great day.